from R1 to R3. Respected Dean Sir, Dr. Arvikar Sir on stage, please. Birud Sir, Arvikar Madam. I would like to thank Dr. Ullas Patil Sir, founder of Godavari Foundation, for gracing the event, Dr. Arvikar Sir, Dean of Dr. Ullas Patil Medical College, Dr. Vikrant Waze Sir, Associate Professor of ENT Department, Mr. Pramod Birod Sir, for gracing the event, Dr. Arvikar Madam, Head of Department of Obstetrics and Gynecology, and our dearest Bindale Madam for gracing the event. And as well, I would like to thank our third year minor students for coming and for coming. Tanushri Madam to enlighten us about today's theme, that is Ear and Hearing for All. Let's make it a reality. The theme of WHO for 2023. Ma'am.
Good morning, one and all. It gives me immense pleasure to have all of you for this event today. As we all know, today is World Hearing Day 2023, 3rd of March. So, the theme every year, WHO sets a theme for this special day. So, the theme this year is Ear and Hearing for All. Let's make it a reality. The main motto behind this theme is the role of primary healthcare workers to who can provide around 60%. Now this World Hearing Day will highlight the importance of integrating ear and hearing care within the primary care. As we all know, hearing can be diagnosed at a primary healthcare center, but for our country like India, I will make a little alteration that even if these 60% conditions that can be diagnosed by the primary healthcare center, they should early refer the patients to us, because rather than good, I think more bad is done, especially in India, at this primary level center. So I would like to say that early diagnosis and early intervention and referral to the concerned specialty should be the motive, especially for our country as India. Integration of ear and health care into the primary care services is possible through training. So I think for India it should be early intervention and early referral. That should be the theme for World Hearing Day, because many a times, especially in young children or the neonates, the condition is not identified at an early basis, which can be done by the specialist at the primary care center, and they must send the patients for further intervention at the earliest possible time. Now I will give you an overview about the causes of hearing loss. As we all know, there are branch of nerve, which is the cochlea or the auditory nerve, which is responsible for this kind of loss. So the congenital causes, it may be microtia, there may be some tympanic membrane abnormalities or some ossicles abnormality, or there may be some congenital syndromes, especially in the neonates which are preterm born, which have prolonged NICU stay, and such neonates have or syndromic children, they have more propensity for the development of hearing loss. And for such, even at our center, even at our NICU, with the help of Mr. Gaurav Patil sir, we have started OAE screening for the NICU patients in our center. Then sensorineural hearing loss, the causes could be genetic disorders or in utero infections. There might be abnormalities of cochlea or temporal bone. Then it can also occur after trauma, or it can be seen in systemic diseases, and most commonly in the old age individuals because of presbycusis, that is it is commonly seen SN loss. And for presbycusis, generally the line of management is use of hearing aid. And many a times that patient who come to us, they have tinnitus along with hearing loss. So if the use of early hearing aid will help them to benefit from both the symptoms of tinnitus and hearing loss. Now this is the diagrammatic representation of the types of hearing loss, that is sensorineural hearing loss, as we have said, in aging, in old age individuals, because of side effects of some of the drugs, because of some auditory tumors. And nowadays very important is noise damage. We seen in college going kids, you might also be having that experience because of this social media and all, the use of hearing, the use of headphones and the use of loud music. This is primarily responsible for development of noise induced trauma or sudden sensory neural loss in lot of college going adults. So we need to inform them, and we need to tell them about the disadvantages of such practices, which should be abandoned as early as possible. Then conductive hearing loss, most commonly that the patients present to us are for tympanoplasty, or those who have perforated drums, or those who have as we say kaan ki haddi sadna, or for mastoidectomies. Okay, so this was just an overview about types of hearing loss and what kind of intervention that can be done. So awareness and taking the right steps for it, and prevention, that is the best thing that can be done to prevent hearing loss. Thank you all for giving me this chance.
So now we know rightly what is the theme of 2023, right? Ear and hearing for all. Let's make it a reality. Reality is with the proper integration with the ENT department, obstetrics and gynecology department, and the pediatric department. So this integration is important. Why? We need to screen the high risk patients, that is the patients in NICU, which will be done with the help of OAE. And to know about the importance of doing,
I would like to thank all of you for giving me this opportunity. And as we all know, every newborn child, he is born with the ability to hear, and we should, hearing loss, as we know, it's not identifiable, it's not visible. There is no anatomical defects which is noticed at birth. So every newborn baby should be screened, and the screening should be done with an OE, or now even with the automated ABR. We'll just have a look at the protocol and why we should do such. We all know Helen.
Among the 4 or 5 topmost audiologists in Maharashtra, I am proud to say Dr. Gaurav is one of them, because he has the command on the subject, he has the sincerity in this subject, and he is an asset for our Khandesh region as an audiologist who is highly experienced. So I congratulate Gaurav. I also am happy that he is always supporting us. Once in a week he comes there, he visits the patients, and the patients are benefited. So these all the investigative procedures, which are very complicated procedures, but these are been made by Dr. Gaurav Gaurav as one of the simplified way. So I am proud that Dr. Gaurav is also with us, and of course my residents, Dr. Harshal, then Shruti, Charu, and Ritu, and of course Basu, my dear Basu, right? So I am very proud, and Dr. Janavi. So there is a very good team of ENT department. Dean sir, if I give numbering number 1 department in our medical college, it is ENT department in our medical college. Because they are very well coordinated. They perform the things which are
staff members of ENT department, other departments, dear students. I am very happy here to be here on this auspicious occasion. So there are different teaching learning methodologies. So apart from didactic lectures or your postings, there are so many other things by method which we can teach the students. So celebrating the various days is also one of the method you can say. So this is adapted. Many times we celebrate by PSM department or ophthalmology department or ENT department. So this is also one of the teaching program we can include in one of the teaching program by the program you can record this as one of the event.
Of World Hearing Day, and special thanks to our respected chairman Ullas Patil sir. Thank you for Arvikar sir for attending the program. Also Anushri madam has taken such efforts to organize all of this event at such a short notice, and special thanks for Gaurav sir to come here and deliver such a good lecture that all of us can understand what is the importance of hearing, what is the importance of screening, and what is the importance of early intervention, so that the people who are having any hearing disabilities can perform better in the society and make society a better place. Also, I will thank the department of pediatrics, Bendale sir and Anekar sir for visiting here, so that we can have a very good interactive thing, so that screening of neonates will become more effective now. And also conducted by Trupti. Dr. Trupti is an excellent orator, now all of you have seen. And also not related to ENT department directly, but related to ENT department indirectly. Dr. Agrawal sir and his team, under control of ENT department. Dr. Agrawal sir, thank you very much for visiting. In spite of not being a topic of your department, still you are taking an interest and coming. That's a very appreciable thing. I thank all my residents who have organized all this program very nicely and effectively, and of course it's a very important thing that the media department and the audiovisual department have organized it nicely. Otherwise all this was not possible. You would not be able to hear my voice. And all the students of nursing and all the students of MBBS third year, I thank you all for attending the program. Hopefully it was an enlightening program, and again I thank Dr. Ullas Patil sir for making all this possible and trying very hard for the cochlear implant program, sir. Thank you.